Anxiety is a common part of everyday life. It's an emotion characterized by feelings of dread, apprehension, tension, or fear. Anxiety can be experienced in short bursts, like before going on a date or speaking in front of a large crowd. It can also be experienced for longer periods of time and at a level of intensity that can impact our well-being. This type of persistent, distressing anxiety is common among those who experience post-traumatic stress, including survivors of child sexual abuse. Due to the traumatic events of their past, a survivor's limbic system may remain on high alert, always bracing for danger. This hypervigilance can continue even after the abuse has stopped and cause the survivor to feel chronically unsafe, even in adulthood. The emotions of fear, betrayal, and helplessness they experienced as a child may linger in their brain and body. And sometimes this stored trauma manifests as anxiety. A survivor's anxiety might flare up in response to a trigger. It will flood the body with stress and urge the survivor into fight, flight, or freeze mode. Other times, a survivor might feel intense anxiety over when the next trigger will occur. They may even avoid certain events, situations, or interactions out of fear over what may happen. Ultimately, such avoidance can interfere with a survivor's ability to live the life they want. Instead, they may isolate themselves and live with a chronic sense of unsafety and dread. Sometimes these feelings of dread can escalate into a panic attack. Other times, anxiety can cause the limbic system to shut down, resulting in dissociation, numbness, and depression. In fact, anxiety and depression often occur in a cycle. Anxiety often leads to feeling a lack of control, perhaps the same lack of control experienced during the abuse. This feeling of powerlessness can lead to a sense of failure, which can become a gateway to depression. Many survivors experience this cycle between anxiety and depression. They may struggle with feelings of frustration, inadequacy, and shame for being unable to break free from it. If you are going through a similar pattern of anxiety and depression, know that this cycle is very natural. Though it may not feel like it, your brain is trying to protect you by using the tools it acquired during the traumatic experiences of your past. As persistent as anxiety can feel, there are many resources to help you manage it. If you are experiencing a disruptive level of anxiety, we highly advise you to seek the help of a medical professional. In addition, there are tools you can learn to help retrain your brain to protect you in a more helpful way. Among the most useful tools is mindfulness. When we mindfully shift our thoughts to our present experience, we not only engage in life more fully, but we can also better manage the pain of the past and the anxieties of the future. We invite you to learn more about mindfulness and other tools to help manage anxiety by exploring the rest of this page and its accompanying resources.